Hi, this is Dr. Shurp Nini from United Medical Group. The topic for today is COVID-19 safety measures update. Ask yourself, are you fully vaccinated? What is the definition of fully vaccinated? For CDC, right now, if you've received the two-shot vaccine, either Pfizer or Moderna, and you waited 2 weeks after your second shot, you would be considered fully vaccinated. Or you've received the one-shot vaccine, the Johnson & Johnson, then you would be fully vaccinated. Almost 80% of the new cases related to COVID-19 infections are related to the COVID-19 Delta variant. According to CDC, most of the cases linked to COVID-19 in the southern states like Arkansas, Florida, Louisiana, and New York in the Northeast are linked to the COVID-19 Delta variant. It's obvious the anxiety surrounding COVID-19 is still pretty prevalent. Currently, in the hospitals, you are seeing patients who are not vaccinated, mostly affected by the Delta variant. But even the population that's vaccinated can get the Delta variant and could become a source of an infection. Other variants currently being studied include the Alpha variant from UK, Gamma variant from Japan, Beta variant from South Africa. Just like any of the vaccines given in the past for other viruses like the influenza virus, COVID virus vaccines may require booster shots to improve the innate immunity you inherently develop post-vaccine. So far we understand, although you may be at risk for catching the Delta variant, your response to the variant will be a lot better if you are already vaccinated. In general, the vaccine is protective to help neutralize the COVID-19 virus. If you haven't been vaccinated, you certainly are at a greater risk. But even if you're vaccinated, based on your health, like being immunocompromised with cancer, diabetes, or taking medications that can suppress your immune system, can put you at a higher risk to catching coronavirus due to poor immune response. We know the current authorized vaccines do not protect you against variants like Alpha, Gamma, and Beta, and only offer some protection against the Delta variant. Current recommendations include masking up indoors in places like healthcare facilities, schools, airports, etc. You're not required to test pre or post-travel or self-quarantine when traveling domestically in the United States. However, for international travel, the US does not require testing or self-quarantine, but check with the country of destination for their specific criteria. You must mask up indoors or outdoors if you're unvaccinated or you're immunocompromised due to cancer or you have comorbid conditions such as diabetes, chronic kidney disease, COPD. Also, the recommendation applies to the elderly population and infants, toddlers who are unvaccinated. If you're unvaccinated and you've been exposed to someone with COVID-19, you have to consider self-quarantine for 14 days. Certainly testing 3 to 5 days after exposure is considered appropriate. If you're vaccinated and exposed to a COVID-19 patient, which is contact within 6 feet of distance for greater than 15 minutes over a 24-hour period, requires you to go into temporary self-quarantine and undergo COVID-19 testing 3 to 5 days after exposure, or choose to wear a mask for 10 to 14 days indoors and outdoors. Note, because you are vaccinated, you have the choice of testing or choosing to quarantine with a mask for 10 to 14 days, ideally 14 days. CDC does recommend for those who choose to test, wait until your test is negative before breaking isolation. Remember, it doesn't matter if you're symptomatic or asymptomatic. you must comply with these recommendations. To summarize, vaccine is going to be our first step to beat this COVID-19 pandemic. You can still get sick with the COVID-19 variants, so be prepared. Always wear a mask in crowded settings. If you're unvaccinated, you must self-quarantine for 14 days when you're symptomatic or after a COVID-19 exposure. If you're immunocompromised, then it doesn't matter if you're vaccinated or unvaccinated. You have a higher risk of getting sick with COVID-19 virus disease. So, we recommend you choose to use a face mask in both indoor and outdoor settings. If you're vaccinated and symptomatic or exposed, you must consider testing after 3 days or wear a mask indoor and outdoors for 14 days. Be ready for a booster COVID-19 vaccine or a new vaccine against current variants or future variants. Always practice good hygiene, hand washing, wiping surfaces with bleach wipes, maintaining social distancing greater than 6 feet. Cover your mouth when you're sneezing. Stay safe.